Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Can you guys hear me now? Okay, let me know if you can hear me or not. I appreciate it. So, whenever you have a hiatal hernia, part of that stomach goes above where it should be, and that causes the stomach to be higher up, or part of your stomach to be higher up than what it should be. And this is actually what happens very commonly, either as a consequence of when we get older, or as a consequence of whenever we either lift heavy things or do anything that can cause that hole to be open a little bit more often. So what are symptoms of a hiatal hernia? Well, because you have part of your stomach above where it should be, that can trap acid to cause heartburn, especially heartburn that is not controlled with acid medication or dietary options. Number two, sometimes it can cause pain. You can have pain up in this area that can be due to a hiatal hernia as well. Number three is that you can also have trouble swallowing. Food can get stuck in that hernia, so you may have difficulty with food going down, or for sometimes that food can just get caught up right in there to cause that symptom of difficulty eating. Now, so how exactly do we diagnose a hiatal hernia? Now, I'll tell you, you cannot diagnose this clinically. I cannot tell you, based on you coming to me in the office, that you have a hernia. It doesn't work like that. Sometimes imaging tests can allow us to see what's going on. Whether it's a CAT scan or an MRI of the abdomen, it can see part of that stomach being above where it should be. But the most definitive test to tell you, if you have a hernia, how big it is, and is it causing issues, it's called an upper endoscopy or an EGD. This is where we use a very small camera inside the upper GI tract to see exactly what's going on. And we can determine if you have a hernia, what type that you have, and could it be causing some of the symptoms that you may be having. So, what do we do about the hernia? It's a big question here. I know people ask me this all the time. Well, it would depend on what your symptoms are. So, for example, let's say you have reflux. Well, sometimes we can treat your reflux medically or even lifestyle, and we wouldn't even have to worry about the hernia. Just because you have a hernia doesn't mean you have to worry about it. Let's say you have trouble swallowing. Well, sometimes we can fix that by opening up the esophagus more, or trying to see if we can find the root cause why you're having the trouble swallowing. Maybe it's pain. Sometimes that pain can be due to the hernia, and we can adjust that as well. But the most definitive treatment is surgical. This is the gold standard. This is how we treat hernias. We actually have to fix this surgically. Now, like I mentioned before, not everyone who has a hernia needs to get it fixed. Absolutely not. It would depend on your symptoms, how you feel, and what we think the cause of your issues are. So let me know in the comments down below if you've had a hernia. Has it caused you issues? Have you been diagnosed with it? How's been your experience with it? Comment down below. I would love to hear what you guys have to say. All right, once again, I am Dr. Islam, and yes, I am your poop guru. Every couple of Tuesdays, I go live on the social media channels. Let me know in the comments if you're watching this live or on the replay. And also let me know in the comments where you guys are watching this at. I love to hear where my audience is coming from as well. All right, question number 2. Hey, Dr. Islam, how to eat the rainbow, or how do I eat the rainbow with IBS? So let me know in the comments down below if you struggle with IBS. Have you tried dietary options? Have they worked? Have they not worked? So when I describe eating the rainbow, it basically means I want you to eat as much variety of food as you can, as many colors as you can. We know the colors in foods, whether it's fruits or vegetables, help bring in the antioxidants into your body to help decrease inflammation and help to promote good bacteria inside your GI tract. So as much as you can eat the rainbow, and you want to incorporate as many foods that don't trigger your IBS when it comes to gut issues. Now, a lot of people get confused when it comes to dietary options for IBS. They see everything all over the internet. Gluten-free, dairy-free, carnivore, low FODMAP diets. And it can be confusing not only for you, but also for doctors like me. So here's what I like to do. I like to try to keep things as simple as we can. We do know that traditional dietary advice does work for IBS. It helps out, and it's simple to do. So for all my patients who have IBS, regardless of what other diets you may have been on in the past, here's what we recommend for all of them. Number 1, have regular meals and never eat too much or too little during those meals. Have a consistent meal pattern and make sure you get enough to eat where you're satiated but not overindulging when it comes to food. Number 2, please make sure you maintain adequate hydration as well. Number 3, you want to reduce the intake of alcohol, caffeine, and bubbly or fizzy drinks. I know if you are a soft drink fan, I know this is not something you want to hear, but if you want to get your gut healthy and get your IBS better controlled, minimizing alcohol, caffeine, and fizzy drinks will help out. Also, you want to minimize fatty foods, spicy foods, and processed foods. You may be a fan of this, but your body may not be. And so I would listen to your body to let you know if you can actually eat these foods. You want to eat as much as you can fresh fruit to a maximum of 3 per day. Sometimes for some individuals, fruit can be a trigger for their IBS issues as well. So kind of be aware of that. You want to try and I wouldn't say be careful, but take fiber slowly. Too much fiber at one time can make IBS issues a lot worse. And for some individuals, you may want to consider avoiding dairy, and for sure, you want to avoid artificial sweeteners. These are kind of the traditional recommendations we have when it comes to IBS. They tend to be simple, tend to work. And if this doesn't work, then we can go on to a little bit more aggressive diets to help out with your IBS. Let me know in the comments down below if you've tried dietary therapy for IBS. Has it worked? Has it not worked? What has been your experience? I think we would love to hear what you guys have to say. Roxy, it's good seeing you. Thank you for watching, and thank you for letting me know about the recording. Diane, thanks for watching from Iowa. Rusty, thank you for watching as well. I really do appreciate that. All right, so Rusty has a very good question. Your daughter has had a hiatal hernia and has been seen again on EGD. She has reflux for her entire life. Is there anything that can be done when a surgical repair has already failed? Is surgery ever recommended again? This is a very good question. So I don't know, obviously, the specifics of your particular case, but there are some times in which if you've had a recurrent hernia after surgery, you can consider in some individuals doing another hernia surgery as well. There are other options that are out there when it comes to acid reflux, whether it's dietary therapy. Sometimes there's other surgical options as well. It's hard to say, obviously, in your specific case, but there are individuals who've had multiple hernias done because that hernia wrap can slip if you've had what's called a Nissen. Nissen, and that is typically the surgery that we do for acid reflux, the traditional surgery. And sometimes it does slip, and sometimes seeing a surgeon can allow you to get that taken care of again. So this should not be a particular issue. Excuse me. All right, Rana, thank you for watching from the Philippines. All right, I think you win the prize for the furthest person in today's Poop Tip Tuesday. All right, next question. Hey, Dr. Islam, can taking medications for acid reflux actually cause stomach polyps? Let me know in the comments down below if you've heard about this. Has this been something that you've been worried about? Has this been something that you have heard about or you were wondering? So the answer to this question is yes, it can. In fact, it is a normal consequence of taking medications for acid reflux. It is your body's reaction to the suppression of acid. It is what's called a positive feedback. Because we're suppressing acid, those hormones get kind of higher that want to make acid, and that can cause these polyps to form in the stomach. The big question is this something to worry about? And the answer to that is no, it is not a big deal whatsoever. Stomach polyps are very different from colon polyps. Colon polyps have a chance of progressing into colon cancer. Stomach polyps, by and large, are benign. They don't lead to cancer, and they're nothing to worry about. Don't worry about it. In fact, I would not recommend at all stopping your acid medications just for the sole reason of not developing stomach polyps. These are not precancerous. They're nothing to worry about. They don't cause any long-term issues. And the benefits of being on the acid therapy may be better for you than some of the potential harms that you may be worried about. So yes, it's very common, but no, it is not a big deal. All right, guys, I don't see any more questions on today's Poop Tip Tuesday. I want to thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe to my channel. Let me know in the comments, and once again, if you're watching this live or on the replay and where you're watching this at. If you wanted to get more information about my practice and my videos, don't forget to check out my YouTube page, my Facebook page, and my Instagram page, where I put comments and information on there about future Poop Tip Tuesdays. Guys, I want to thank you for watching. If you haven't already, smash that like button. And guys, don't forget, let's talk about poop. Thanks, everybody. Hope you guys have a happy and healthy day.